Well, welcome to this instructional video on how to care for children that have had gastrostomy tube insertion. Our intent here today is for you to understand how to care for this device at home, and I think that this will really help facilitate the care of your child. The placement of a gastrostomy is often required for several conditions, primarily for children who are unable to swallow or for whatever reason are not taking in enough nutrition on their own. So having a tube that's directly into the stomach enables one to feed into the stomach and make up for what the child is unable to take on their own. Other situations for having a gastrostomy include draining the fluid that might accumulate within the stomach to prevent the child from throwing up, and also keep them from having to have a tube down the nose to either deliver nutrition or to drain the fluid from the stomach. The care of your child with a gastrostomy involves many different individuals with various responsibilities. So you will have an exposure to nurses at the bedside, nurse practitioners, attending surgeons, as well as residents and fellows. All of them have various responsibilities and contribute to the child's care. We welcome any questions that you have to anybody along the way because we are a team. We all want to be on the same page, so any of your questions are quite welcome.
Welcome to our program. In this program, we'll demonstrate how to deliver nutrients and medications through the tube and how to apply a dressing to the site. You may choose to watch all segments in order or focus first on the specific topics you feel are priorities. We encourage you to replay specific material as often as needed. We also suggest that you share it with others who may be involved in your child's care. Also, refer to the guide you received from the surgical team for more detailed information about your child's appliance. We have a lot of information to cover, so let's get started.
The placement of a gastrostomy is essentially putting a tube into the stomach. This is a surgical procedure, and one way to do this would be to make a small incision in the abdomen and place the tube under direct vision into the stomach and then bring the tube out separate from that incision. Another would be to use various laparoscopic techniques whereby the stomach can be visualized inside the abdomen and a tube can be placed directly into the stomach that way. And sometimes it's a blind approach where we inflate the stomach with a scope that's inserted into the stomach itself, and then through a needle and a series of dilators we can place a gastrostomy that way. There are two basic types of tubes. One is a longer tube, and one is called a button, which is more at the skin level. Sometimes a button can be placed up front as the initial operation, and sometimes a longer tube is placed, and that can be switched over to a button in children in whom that's an appropriate option.
The gastrostomy appliance is inserted into the stomach after it passes through an opening made in the skin, fat, and muscle layers of your child's abdomen. This opening in the skin is called a gastrostomy tract. The bottom of the gastrostomy appliance has a balloon or mushroom type of device that helps keep the appliance snug against the stomach wall without falling out. The size will be listed on the tube. The label FR stands for French. French refers to the diameter or thickness of the tube. Your surgeon will decide what appliance is best for your child based on your child's anatomy. The surgical team will provide more specifics regarding your child's particular appliance. There are several gastrostomy appliances available on the market, but in this video, we will only discuss the gastrostomy tube, also called a G-tube. Following surgery to insert the G-tube, your child will need rest, pain management, IV fluids, and sometimes IV antibiotics. Your child will come out of the operation and may still be a little sleepy from anesthesia. This is normal. For the first 24 hours after surgery, your child's gastrostomy appliance may be connected to a small plastic container. This allows any stomach contents to drain out. Even without eating or drinking, the stomach normally makes juices. Draining these fluids prevents the stomach from getting too full after surgery. Usually, your child will not take in fluids by mouth or by the G-tube for the first 12 to 24 hours after surgery. This helps relieve nausea after anesthesia and allows the gastrostomy tract to begin healing. It will take about 6 to 8 weeks for the tract and the surrounding tissues to heal completely. Your child will be allowed to have some medications through the tube or by mouth in those first 24 hours. After surgery, the surgical area may be tender for several days. It can also be normal to see drainage around the tube. The nurse will check your child frequently for pain and discomfort after surgery and will give pain medications as ordered by the surgeon. The nurse will also check for heavy drainage around the gastrostomy appliance and will monitor the amount of fluid draining from your child's stomach. Once the surgical team determines your child is ready, the container will be disconnected from the G-tube. You may notice sutures or stitches around your child's gastrostomy appliance. These are used to anchor the appliance to your child's skin. Later, in your child's postoperative recovery, sutures around the appliance will be removed. This usually causes very little pain. Sometimes the stitches can come loose or detached prior to being ready to be removed by the surgery team. If this happens, please call the surgery office. Once your child is discharged from the hospital, you'll need to continue care at home. As with every medical device, there are some simple guidelines that should be followed. First, it is important to prevent the gastrostomy tube from being accidentally pulled out or dislodged. In order to prevent this, you may dress your infant in a onesie or place an ACE bandage around the abdomen in active toddlers and children. Before your child goes home, you will be given instructions about a diet and feeding schedule that deliver the calories and fluids your child needs. There are 2 forms of feedings. One form of feeding is done using gravity. The other uses a mechanical feeding pump. We'll cover each of these in a few moments. But first, some general guidelines. If the feedings are given too fast, your child may feel cramps, including belly pain, retching, or vomiting. When giving feedings, remember to do it slowly. You may place your child in a safely secured infant seat, wheelchair, or chair during feedings. Your child may also lie on his or her right side if getting fed at night. This will help to empty the stomach. Gastrostomy tubes are clamped when not being used to prevent formula and gastric contents from coming out of the tube. Use the clamp already on the tube if present, or an end cap on the gastrostomy appliance. Never use the blue clamps, referred to as gizmos, on the gastrostomy appliance or tubing. If the gastrostomy appliance does not have a clamp or end cap, then you may use the cover off the end of the feeding syringe. Gently push it into the end of the gastrostomy appliance. You can also use a soft hair rubber band as well. Remember, the gastrostomy appliance should be flushed with 5 to 10 milliliters of water after every feeding and with medications. It should also be flushed once a day, even when it is not in use, to prevent clogging. We encourage nurturing your child during feedings. It is an important time to continue to provide your child with pleasant sensations and opportunities for bonding. This may include holding, rocking, and talking to your child during feedings. To deliver a gravity feeding, which is also called a bolus feeding, assemble your supplies first. You'll need formula, a feeding syringe, and water for flushing. Once you've assembled your materials, follow these steps. Wash your hands. Remove the cap from your child's G-tube. If there is a rubber band in place, remove it at this time. Then attach the syringe to the tube. Pour the formula into the syringe and hold the extension set at the level of the child's stomach. If your child's appliance has a clamp, open the clamp now. Raise the syringe until the formula flow slowly increases. If needed, lower the syringe to decrease the flow. Formula should go in over 15 to 20 minutes. The formula may come back into the syringe if the child is fussy or crying. Just wait a few minutes. The formula will go in again once the child calms down. When the feeding is complete, flush the tubing with 5 to 10 milliliters of water. Clamp the tube, then disconnect the syringe and replace the cap, and if needed, the rubber band. Wash supplies with soap and water. Rinse and allow to air dry. You may reuse your supplies, so you want to make sure they're clean and ready for the next feeding. Feedings delivered through a mechanical feeding pump can be continuous during the day or night, or they may run over several hours. To deliver a feeding using a mechanical pump, assemble your supplies first. You'll need a feeding pump, tubing or bags, formula, feeding syringe without plunger, and water for flushing. Once you've assembled your supplies, follow these steps. Wash your hands. Pour the amount of formula needed into the feeding bag. Open the clamps of the feeding bag. Fill the tubing with formula. This is called priming. Then close the clamps when the formula reaches the end of the tubing. Place the pump tubing into the pump and then attach the tube after removing the cap or rubber band. Open the clamp on the gastrostomy tube and pump tubing. Check the rate of the pump. Start the feeding pump. The feed will then run over however many hours you have been instructed. Please note, depending on the type of pump that has been ordered for your child, it may look different than the pump in this video. Even so, it will operate the same way. Your home health company will go over your pump with you. Clamp tube set at the end of the feeding. Turn off the pump. Remove the pump tubing from the tube and attach the feeding syringe to the tube. Pour 5 to 10 milliliters of water in the syringe. Open the tube clamp if present and allow water to flow in, and then clamp the tube. Finally, place cap or rubber band on the tube. In order to prevent pulling on the tube during feedings, you'll need to tape the tube. Before you get started, assemble your supplies. You'll need scissors, skin wipes or skin prep, a washcloth, and tape ordered through Home Health. Once you have assembled your supplies, follow these steps. Wash your hands. Clean and dry the area on your child's abdomen where you will tape the G-tube. Wipe a skin prep pad on the skin where the tape will go. If your child's skin is irritated, your surgery team may order a special dressing, known as Duoderm. You can place the Duoderm on your child's skin and then tape the extension set to the Duoderm dressing. After the skin prep gets sticky, lay the tubing on the skin prep and cover with tape. Remember to move to different spots in order to help prevent skin breakdown. When your child must receive medications through the G-tube, ask your pharmacist to dispense all medications in liquid form if possible. Ask the pharmacist whether you can crush the tablets or open the capsules yourself if a liquid form is not available. Then dissolve them in water before delivering them through the gastrostomy appliance. Your child's tubing may have a medication port. This is a smaller opening in addition to the one used for feedings. If your child has this second port, you must make sure the feeding port is closed when using the smaller medication port. To administer medications through the G-tube, follow these steps. Put the medicine syringe into the smaller port. Unclamp the tube and slowly push medicine into the tubing. Clamp the tube. Disconnect the medicine syringe and close the medication port on the tube. Open the medication port and attach the syringe with 5 to 10 milliliters of water to flush the tubing. Unclamp the tube and push in the flush, and then clamp the tube again. Remove the syringe and close the med port. If your child's G-tube does not have a medication port, The tubing will have only one large opening. To give medicines through this type of tubing, follow these steps. Remove the cap and rubber band if present. Attach the feeding syringe without the plunger directly into the tube. Open and unclamp the gastrostomy tube if there is one present. Put the medicine into the feeding syringe and allow it to flow into the tubing, as you would if feeding by gravity. Put 5 to 10 milliliters of water into the feeding syringe and flush the tubing. Clamp or close the tubing and replace the cap or rubber band. Most children who have gastrostomies can burp or pass gas on their own to relieve the excess air in their stomach. However, some children have problems doing this. When this happens, you can help relieve gas from your child's stomach using a procedure called the venting technique. Follow these steps to use the venting technique using a syringe. First, remove the plunger from the feeding syringe and attach the syringe to the tube after opening the G-tube cap. Hold the syringe about the level of your child's stomach and unclamp the tube. You will see excess gas bubble up into the syringe. It is not uncommon to see formula or stomach juice rise into the syringe. Once the gas is relieved, allow the formula or stomach juices to slowly flow back into your child. Clamp the tube and replace the cap or rubber band to close the gastrostomy appliance. Your child may have an anti-reflux procedure performed. If this is the case, your child's medical provider may order a Ferrel bag. To learn more about the Ferrel bag, refer to your Ferrel bag teaching tool. As with any surgical site, it is important to keep the skin around the gastrostomy appliance clean. You should clean around your child's G-tube with soap and water 3 times a week. Rinse the area well and then pat dry. Check the site daily for redness larger than the size of a quarter, swelling, tenderness, skin irritation, rashes, or drainage and leakage around the gastrostomy appliance. If any of these occur and last more than 24 hours, please call the surgery office. Remember, do not rotate the appliance unless it is causing pressure on the skin. Rotating the device may cause the site to become bigger and develop granulation tissue. Granulation tissue is pink, fleshy tissue that forms in the healing process. If you notice drainage or redness, you should clean the area more frequently. Young children should only have a sponge bath for the first 1 to 2 weeks after returning home. Older children may shower for the first 2 weeks. This helps protect your child's surgical site. After 2 weeks, both younger and older children may have baths. Gastrostomy appliance sites rarely get infected, but leaking can commonly occur. A dressing may not be needed unless the site is leaking or you are instructed by a surgeon to place a dressing at the site. Bath time is a good time to change the dressing. If it has been less than 2 months since the button was placed, call the general surgery office with any questions. It's important to learn how to change the dressing around your child's gastrostomy tube. When done properly, the dressing will also help secure the device and help keep the skin around your child's insertion site healthy and comfortable. If your child's appliance is a tube with a disc, you'll need the following supplies to change the dressing: a washcloth or Q-tip, soap and water, stomaadhesive powder, split 2x2 gauze, tape, and scissors. Once you have gathered your supplies, wash your hands. Then remove the tape on the silicone ring and take out the gold gauze. Hold the tube straight up and clean the skin around the tube with warm, soapy water. Rinse the area and pat dry. Sprinkle stomaadhesive powder around the tube if there is lots of drainage. Place 1 2x2 gauze with a split under the disc, and then place 4 pieces of tape to cover the ring, gauze, and skin. This is called H-taping. If your child's device has a nipple, you'll need the following supplies to change the dressing: a washcloth or Q-tip, soap and water, split 2x2 gauze, tape, and scissors. Once you have gathered the supplies, wash your hands. Then remove the tape on the nipple and remove the old gauze from under the tube. Hold the tube straight up and gently lift up the nipple. Clean the skin around the tube with warm, soapy water. Rinse the area and pat it dry. Put a gauze pad under the red nipple with the split facing up, and then one under the nipple with the split facing down, the opposite direction. Hold the tube and gently push the nipple down on the gauze. Place 4 pieces of tape on the nipple and skin. This taping is called H-taping. If you notice leaking around your child's G-tube and your child has had the tube for less than 2 months, or if leaking continues, please call the surgery office. However, here are some helpful tips. When stomach secretions leak onto the skin around the gastrostomy appliance, it can be very irritating to the skin and cause it to break down or turn red. Several products are available to help protect your child's skin. Stomadhesive is the most commonly used powder used to help absorb some of the drainage while protecting your child's skin. Here's how to apply it. Sprinkle stomadhesive powder around the gastrostomy daily after bathing your child. You may also use a piece of gauze over the powder to absorb additional leakage. Stomadhesive powder can be sprinkled around the tube and will not hurt your child if some of the powder goes into the gastrostomy appliance or stoma site. Moisture may cause a rash. If the bumps or rash do not clear up after using stomadhesive powder, call the surgery office. There are other dressings available to help with irritation. Call the general surgery office for advice on other products that can be used. Children often develop granulation tissue around the gastrostomy site. This is extra tissue that grows around the gastrostomy. You cannot always prevent granulation tissue from forming. The tissue contains many capillaries, or small blood vessels, that make it look red or pink. It looks just like the gums inside of your mouth. Do not worry if you see tiny spots of blood if the tissue becomes irritated, because this is normal. Granulation tissue is not an infection, but can sometimes have yellow drainage. Granulation tissue may go away on its own, but may need to be treated. Call the general surgery office if the tissue becomes tender, drainage increases, or it's causing the gastrostomy appliance to fit improperly. A nurse or nurse practitioner can order a small Q-tip with medicine called silver nitrate to be applied to the tissue. The medication helps the tissue shrink and dry up. After it's applied, it can make the tissue look dark gray or white. Gastrostomy appliances, on very rare occasions, may come out. There is no immediate danger to your child. Formula or food may leak from the site, or you may see a small amount of bloody drainage. If your child's appliance comes out within 2 months of surgery or before the first gastrostomy change, you'll need to take several steps. You will be sent home with a take-home bag and 2 replacement tubes called Foley catheters. One that is the same size French as the one found on the tube and one size smaller. Make sure to keep these items in a handy location. When you find your child's gastrostomy appliance has come out, cover the opening with a washcloth. Do not put the old tube back in. The tube is blunt, which may push your child's stomach away from the abdominal wall. Next, assemble your supplies. You'll need a Foley catheter, a washcloth, water-soluble lubricant, tape, a measuring device, and scissors. Take a deep breath and try to relax your child. Get the Foley that is the same size as your child's G-tube. Put a small amount of water-soluble lubricant on the tip of the Foley. If your child's weight is less than 15 pounds, gently insert the tip of the Foley about 1 1/4 inches or 3 centimeters. For children who weigh more than 15 pounds, insert the Foley in about 2.5 inches or 6 centimeters into the gastrostomy tract. Your child may cry, wiggle, or kick, which can cause the abdominal walls to tense. Try to relax and comfort your child. When your child breathes out, the abdominal muscles will relax and the Foley catheter should slide into the opening. It is important to remember not to force the tube into the hole. If you are unable to get the Foley catheter in, try the next size smaller. Do not take more than 10 to 15 minutes to try to insert the replacement tube. Once the Foley catheter is inserted, tape the tube to your child's abdomen. Do not blow up the balloon on the Foley. Also, do not give any water, medicine, or try to feed through the tube until cleared by a general surgeon. You will need to take your child to St. Louis Children's Hospital emergency room. You should call the surgery office or the pediatric surgeon on call to notify the emergency room you are coming. If you are unable to insert the tube, take your child to your nearest emergency room if you live outside the metropolitan St. Louis area. Have the local emergency room physician call the surgical resident on call at St. Louis Children's Hospital. You can reach the surgery office 24 hours a day. If your child has had the gastrostomy appliance less than 1 month, you should call the pediatric surgery office if your child has a swollen, hard, or bulging stomach, has purulent, bloody, or bright green or brown drainage that smells like stool coming from the gastrostomy appliance, is throwing up his or her feedings, has pain or cramping with his or her feedings, is crying without tears, has a dry mouth or cracked lips, if your child is an infant and has a sunken soft spot on his or her head, is sleepier than normal, or complaining of dizziness. If your child is an infant and has not had a wet diaper in 8 hours or has no urine in 12 hours at any age. Here are some frequently asked questions. Please refer to this list. If you have a question that is not answered, please contact your doctor or the surgery office. If my child has a gastrostomy, how does this affect normal mouth care? It is important to remember to continue wiping off your child's mouth and brushing your child's teeth, even if your child may not take medicines or food by mouth. We recommend that you give mouth care at least twice a day. Can my child swim or bathe? After 1 to 2 weeks, your child's gastrostomy appliance should be healed and your child can bathe or swim in chlorinated water. After 4 weeks, your child can swim in lakes, rivers, or oceans. Clean the gastrostomy site immediately after your child returns from swimming. Water may leak into your child's stomach. This is okay for most children, unless your doctor advises you otherwise. Can my child lie on his or her gastrostomy appliance? Yes, once the site is no longer tender. Infants may lie on their stomachs for tummy time. Older children may sleep or lay on their stomachs as tolerated. Does my child have to go back to surgery to remove the gastrostomy appliance? No, most gastrostomies are removed in the general surgery clinic, and most close up in several weeks. Some leaking from the stomach is normal after removal of the gastrostomy appliance. The nurse in the surgery office can show you how to put a dressing over the old gastrostomy site. However, your child may require an operation to close the opening if the gastrostomy was in place for a long time. How do I clean the equipment? Clean the attachments and syringes with soap and water. Rinse well and allow them to air dry. Do not put any of the attachments or syringes in the microwave or dishwasher. What is granulation tissue? This is a tissue that may grow at the opening of the gastrostomy and is a normal occurrence. It is a pink, red color, moist, and looks like the tissue of your cheek on the inside of your mouth. The tissue contains many capillaries or small blood vessels. When it is irritated, it is common for this tissue to bleed. Granulation tissue can also produce a yellow drainage. This is not considered an infection. Granulation tissue is not harmful. Granulation tissue cannot be prevented. Granulation tissue sometimes goes away on its own. However, if it becomes a problem, please contact the surgery office. We hope this program has been helpful. If you have additional questions, contact your child's doctor, 314-454-KIDS, or the surgery office at 314-454-6022. You can also learn more by logging on to our website.